Maybe you or a family member have gone in for surgery. I know I've had several surgeries in my body over my time. But the one thing I've never thought about is having my mouth checked prior to going into surgery. Is that important? And you had something happen actually literally today about that.
Literally today. I had a new patient call. Her husband is having open heart surgery next Thursday.
Okay.
The doctor told her yesterday she needs to get a dental clearance. So this is 1 week to get a dental clearance for surgery, and he hasn't seen a dentist for years.
Okay. Well, that brings up a couple questions.
Yeah.
I think you know what they, for the one thing is why, after several years of the doctor perhaps not asking, do you have dental care, is he asking for a clearance?
Well, because they're going to do surgery now. So if you do surgery and you've got a lot of bacteria from the mouth getting in the bloodstream, that can really decrease the success of that surgery. So you want to have a healthy mouth. The challenge is you can't clear a chronic situation in an acute setting. You can't make the mouth healthy in 7 days. Okay? It takes a little while. But my question is, why did you wait until they needed surgery before you wanted to have a dental clearance?
Right.
That should be done right away so they can at least rule out the mouth as a source of the bacteria that's getting to the heart valves or the whatever's going on, the cardiology situations.
So it almost seems like the doctor had enough knowledge that the mouth is an important part of the body, enough prior to surgery, but not for maintenance.
Well, they know that there's a liability issue. I mean, if you do surgery and they've got some dental infections going on, and you know they've got infections and you're doing it, that could lead to some situations.
A really bad Christmas for them.
Yeah,
right?
yeah. So you want to make sure that everything is healthy dentally before you start working on the heart.
Okay.
And this is where, but it's not just the heart, it's the body. If you're going to have surgery, if you're going to have anything done, just imagine you've got bacteria going through your bloodstream when your body's trying to heal from, I don't know, gallbladder or whatever other kind of surgery. So the healthier your blood is, the least bacteria you have, the faster you heal.
So I'm going to take this to the extreme and say this man's having heart surgery. Is it possible that he has mouth issues that caused the heart surgery needing to be done?
According to the researchers, 50% of heart attacks come from dental infections.
Did you say 50?
50. Okay, so if you're going to buy a lottery ticket and the odds are 50-50, are you going to buy a ticket?
I'm going to buy it. I'm going me, several, and my family. Yeah.
There you go.
Yeah.
But there's a 50-50 chance it doesn't, but there's a 50-50 chance it does. I mean, the odds, I want to make sure I have a healthy mouth.
That absolutely blows me away.
Yeah.
That phone call was profound on several levels. First of all, as I kind of recap, possibly if he had mouth maintenance, is that what you call it? Maybe he wouldn't need the heart surgery.
That's correct.
The fact that he needs to have clearance speaks volumes as to the importance before you go into surgery.
Yeah.
And it also leads to the question of if the doctor knows this is important, why hasn't he asked long before the surgery came up?
Why is it a last-minute thing?
Yeah.
Why is it a last-minute thing? So personally, for each one of you, make sure you have a healthy mouth. If you've got a family member that's going to be having surgery, no matter what kind of surgery, any infection in the body is going to slow down the healing. So let's see if we can at least rule the mouth out as a source of infection and let them heal a little bit faster.
We want to give you access to Dr. Chuck because he is a great source for he's really funny too. But you can contact Dr. Chuck with some questions, maybe share some stories. Dr. Chuck, how can people get a hold of you?
It's AMA, which is Ask Me Anything, AMA at thedentalmedicalconvergence.org.
And please feel free to share this, to like it, to post it, and maybe if you're on Facebook, go into some medical rooms and Facebook groups and share how important this is. Yeah. Very good.
Yeah, the idea is to minimize issues for people, because when one person has a heart attack or a stroke or these other issues, it doesn't affect one person. The whole family's life is turned upside down. Transportation, appointments, all this, it's a mess. Yeah. So let's avoid that in the first place, if we can.
Thanks for joining us.
Yeah, thank you.